So make sure you do those. And if you have any questions about that, you have plenty of contact information for all of us. And then we will also make sure to get that out to you, and we will get you your CEU for sure. Okay, so today, there we go. Today, yep, we are, I'm going to review kind of our agency and the programs and services that we offer. And then we're going to be talking about the PRCs, the Prevention Resource Centers, a little bit about what they are, what they do, how many they are, where they're located. And the bulk of what we're going to be doing is going over the regional needs assessment and the findings that came out of that. Kay, along with the other staff in the PRC, heavily Kay, with a lot of support from her team, have put together this wonderful document that we're all able to use and utilize in all of the different areas that we work and all of the different missions that we work under. It's great information. It's a great way to get, state, region, county level data that benefits all of us. So she's going to take us through that, and we'll be enlightened to all of the things that she found working with her partners across the state as well. So who are we? We are Recovery Resource Council. I know a lot of you have relationships with us and you know about us, and you definitely know about a lot of our prevention services, but we are a very large nonprofit organization specifically dedicated to prevention, intervention, and treatment of alcohol, substance use disorders, and behavioral health issues. And so if you don't know about all of the pieces, you might learn something new today as we go over that. We do currently, though a lot of us are working remotely, as are a lot of you, we do have 3 physical locations. Each location kind of houses its own set of programs, its own set of services, but there are 3. So there is the one that's located in Fort Worth, which we refer to as our West Campus, and the one that's located in Dallas that we refer to as our East Campus. And then we also have some counseling services that have a location in Denton, the city of Denton, also Denton County, and we refer to that as our North Campus. So we spread across North Texas pretty good. All right, our mission: to promote wellness and recovery from alcohol and substance use disorders and trauma. That is something that is that all of those things are really weaved through all of the services that we have. And we're very proud of our agency guarantee. This is something that our staff all know. They live by it. This is for each other, working with each other, working with the community, working with the stakeholders, working with clients, everyone. When you come in contact with Recovery Resource Council, you will absolutely get unconditional acceptance, respect, and positive regard. It's something that our agency agreed was our guarantee. That was the one thing that we could guarantee. We're going to try our hardest and work our best to get you anything else you need, but for sure you're going to get unconditional acceptance, respect, and positive regard. Okay, our prevention programs. We have 5 big ones, and then we have, some subgroups of those big ones. So our Sunshine Club is an elementary level program. As you see, it's ages 5 to 11. We utilize the Rainbow Days Kids Connection community-based support group curriculum. And that is something that we have had for many, many years. I'm not sure if Miss Kim is on here right now or not, but she has been facilitating this curriculum and working with Sunshine Club for about 24 years. So that's something we're very proud of. It's one of the things that we have in the areas that we serve the largest demand for, and a lot of really great feedback and evaluation on that program. Our Project Ascent prevention program, that is our universal prevention program. We utilize the Botvan life skills training. We serve grades 3rd through 8 with that one. We've also been doing that one for a very long time. I don't have the numbers on that, but it's for sure been at least 16 years. I don't know if Lisa wants to jump on and correct me, but it's been about at least 16 years that we've been using that curriculum and facilitating that in the Tarrant and surrounding areas. And then we've also recently been able to expand into the Dallas County and surrounding counties as well. I know, and it says ages 12 to 15, but there, we are able to do, we recently have expanded and started serving 3rd through 5th grade as well. Our Ground Zero program, so that kind of encompasses 2 programs. We have 2 YPI programs, or indicated youth prevention programs. And so they kind of split the counties that we serve. So our youth prevention education programs, they do not cover all the 19 counties that we'll be talking about with that the PRC serves, that the Prevention Resource Center serves. However, we do cover about 10 counties. And so we do have 2 YPI programs that kind of split those counties, if you will. And we are utilizing the positive action curriculum for one of them. And then the other one is utilizing the Project Towards No Drug Abuse, or No Drug Use, sorry. Another thing that we have started and that we're super proud of is something called Camp L4. We have been doing Camp L4 since 2007. Just looking for a head nod, thank you. 2007. A few times a year, we are able to take 20 to 25 kids most of them are currently living in a state of homelessness, but some of them are also kids that are, whose parents are going through, are trying to get themselves into recovery, or they're going through the foster program or something like that. And so we get to take them out to camp. We take them out to Camp Carter, and they get to be kids. They get to be kids for a week. They spend 4 days out there. It's not overnight, it's just during the day. And we weave in so much prevention education during those times. We try and touch every topic that we can and weave it into some activities that we do to reinforce all the messages that we teach. And ultimately, we do everything we can to build relationships with them, because we know one of the things that anyone who works with youth knows is that a positive relationship with an adult is really going to be huge in their life, and it's going to leave a good lasting memory for them. So that's what we're trying to do at Camp L4, is create those positive lasting memories that give them something happy to think back and smile about. We have our Prevention Resource Center, which you are going to hear about from Kay here shortly. We do house the Region 3 Prevention Resource Center. So a lot of you maybe have already spoken to us about the Prevention Resource Center and what we can do for you and what we can provide for you. Essentially, it is a data repository for the region. So if you ever have any data questions, come to us. Come to Kay or Roslyn or Victoria or Devin or Becky, who is not able to be on here today. So if you are a part of our PRC team, will you please kind of give a little wave? I guess technically we all are, but officially that is our PRC team. Okay. We also have the Dallas Area Drug Prevention Partnership. This is a coalition that is led by Becky Tinney, who is our Director of Community Relations. Director of Community Engagement. Sorry about that. She's not able to join us today. She had something else that she was committed to, unfortunately, and had to do that. But we miss her, and she is still keeping the Dallas Area Drug Prevention Partnership alive, along with all of our wonderful coalition members. So thank you guys for all that you do to keep that going. And then Tobacco Free North Texas. That is in large part kept going by Victoria. Victoria, I just saw your face and now I can't see you. There you are. Hi, Victoria. So Victoria heads up our Tobacco Free North Texas group. If you guys have any questions about that, please send them her way. All right, so I can't believe that all of our other services were able to shrink down and fit on one slide. But Kay is kind of a PowerPoint mastermind, so that I'm sure is why. But our clinical services do include counseling, substance abuse counseling, or other mental health counseling. Enduring Families is our veteran program. What's really cool about that program is that if the service member isn't ready for services, or they don't want the services, but their immediate family members are ready and do want it, we're still able to serve them. And that program does include Yes, it includes lots of licensed counselors who are also certified in EMDR. But in addition to that, we have peer navigators that kind of help them navigate through the different systems that they're working in to make sure that they have the resources that they need. Our INR, or information and referral hotline, I always like to say it's kind of like a miniature 211, except for their knowledge and reach is so big. They're kind of our first line of contact for people who are looking for help. And when I say help, yes, a lot of that does include substance use, but in addition to that, they are able to help connect people with other resources in our area, and also even out of state sometimes. I've experienced that. And then OSAR is kind of our bread and butter. That's where we started. That's where we are getting people who are ready for treatment services hooked up with the treatment that they need. Mostly it's a state funded program. And so, you know, we're getting people who don't have the financial resources for treatment hooked up with treatment services that they're able to access. Under our special population services, this includes, as you can see, there are 3 programs there. A lot of it includes housing. So as a lot of people do, we utilize the housing first model. So our idea is, or the theory is, let's get a roof over people's head, and then we'll start looking at these other gaps that they might need filled in order for them to be successful and thrive throughout their life. That program's been going on for over a decade, and it's super successful. And there have been a lot of people that have been able to get to self-sufficiency through those different programs. And then we do have some other services. We do some offender education, or some community education is how we call it. And that is for people who do have some minor charges that are needing to get back on track and kind of figure out how to get their life back on track. So we have those classes. We provide trainings and workshops, and then we also have a community service program. So if anyone is in need of fulfilling some community service hours, and this could be like a probation offender kind of community service, but it could also be, you know, National Honor Society community service, or community service for different leagues and clubs throughout the areas that we work. So I know that was a whole lot that I threw at you all at one time. So please visit our website if you want any more information, or reach out to us, and we would love to get you as much as we can. So, all right, with no further ado, I am going to pass things along to Kay. Kay, we are so excited to hear everything that you have. She has worked very hard on the RNA, and I know she's really proud to be able to present this to everyone today. So thanks for being here, and welcome, Kay.
Thanks, Erin. Can everybody hear me okay? Also, oh, I got it right this time, Erin, look. So my slides have closed captioning on them. And yesterday I was telling Erin that it always spells her name wrong, and then it did it right this time. So that has to be a great sign of something, right? So thank you all for being here this morning. I know you guys are excited about the data we found. So without further ado, I'll jump right in. So the Prevention Resource Center, as Erin mentioned initially, there are 11 in the state, and we are Region 3, so I highlighted that for you. So we're the Dallas-Fort Worth Metroplex area. If you go through when you go through the RNA, because I know you'll want to jump in right after this presentation, or you've already done that and you're just gonna go through it a second time just for kicks. So when you go through the RNA, you'll see that when I reference a region, I also put in like what the official title is per the state, just so that way it makes it easier for you to reference in your mind. So here's a little map. And then here's a zoom in of what our 19 county service area looks like. So our prevention priorities, and they're the same for all the PRCs, are the same as the states, which are underage alcohol use, tobacco, nicotine products, marijuana, and prescription drug misuse. The PRCs serve as essential data repository, so not just collection, but also analysis and dissemination. We do all that data analysis and collection and combine it and compile it into a needs assessment that comes out every summer, which I'll talk more about in a second. And then we spend the year telling everybody about it. So this is part of that. So we also coordinate prevention trainings throughout the region. So our PRC's PRC, which is Public Relations Coordinator, Rosalind, she is our liaison to the state, this region's liaison to the state to get HHSC prevention trainings to prevention providers. Victoria does our compliance checks. With COVID now, we're doing mail-in compliance checks, which is slightly different. It is more self-reported than us going in and like doing checkups ourselves. And then we promote the Texas School Survey. A good amount of our youth data comes from the Texas School Survey, whether that be use or just perception of harm, peer approval, parental approval, things like that. And also PRC3 houses a resource library with pamphlets, booklets, books, DVDs, display cases, displays, just to kind of, not just about substance use, but things that relate as well. So mental health, talking to your kids about drugs, things like that. So before we start, I kind of want to know where everybody's at, right? So I'm going to stop sharing so Erin can share her screen. So the question is, so when I hear the word data, I think, so she just dropped a link in the chat and she'll explain to you what to do with that.
Yes, so if you guys are familiar with Mentimeter, if you have used it, there it is. Okay, here you go. If you guys will please head over to menti.com and put in the code. I just dropped the code in the chat. And we should start hearing everyone's words pop up. What do you think? I mean, seeing. You're right. Keep yourself muted. I forgot. There we go.
Ooh, money. I like that. Yes. My kind of people. Okay, research is also my kind of people. Sorry. But money though. Pattern. Evidence. That's good. Numbers. To the point. There you go. Time. Good stuff. Good stuff. Statistics, charts. Story. Okay. We have some data, people. Intel. Oh, that's super technical. Okay. Empowerment. I love that. Yes. Sorry if I'm really loud and yelling in your ear. Data is exciting. Welcome to my world. Okay. Spreadsheets, service needs. I don't know why I'm staring at my screen. There's a bigger screen over there. Sorry, I'm in your face. Okay, these are all really good. These are all really, really good. Okay, we'll give it a couple more seconds. I don't want anyone to not be included. Okay. Verification, validation. This is really good. This is good. No negatives so far, which is great. Don't be the person who puts in a negative now because I said that. But yes, this is great. Efficiency. Okay. All righty. So thank you all for participating. You can still drop some in there if you think of something while we're presenting. But I'm going to get back to the presentation. If it'll let me share. Technology, am I right? No. Where was I? There I was. Okay. Oh, good. It did it the way it did before. Okay, so great. So a lot of you got it, right? So information, research, money, all the things that we love in prevention, right? You know, data at its simplest form is information, right? So throughout the presentation today, I want you to think about the information that you're being given and what that really means for you, not just as an individual, but also for your agencies, your programs, your community, et cetera, et cetera. Because information does no good just kind of sitting in a binder, sitting on a shelf, sitting on a website. Information should be used to inform decisions, right? So for example, the weather is information. And in Texas, it's like really information. So if you're a native Texan, you know that when you wake up in the morning, you check the weather, but you also check it for throughout the day because you could have 4 different climates in one single day. So you need to pack your umbrella, you need to pack snow boots, you need to pack whatever for the day. But if you just check the weather and do nothing with that information, it's just information. It's not information used to inform a decision. So it does no good if you know what the weather is, but don't really make adjustments for that. Or if you can't make adjustments for that, right? You don't have the tools, you don't have rain boots, you don't have a rain jacket. You don't have snow boots because you live in Texas and it snows once every 6 years. So that's just something I want y'all to be thinking about throughout this presentation. What can you do with this information? Which we'll revisit at the end. I forget that when I click out, my clicker doesn't work. Here we go. So the regional needs assessment is done yearly, as I had mentioned earlier. So it really aims to get the substance use patterns and trends, but also things that are related. So risk factors, protective factors, consequences, not just for our region, but for the state as well. So the way it works is there's a state evaluator and then 11 regional data coordinators. And we work together for the bulk of the year. So usually it's September to May. This last year, like everyone, all of us were kind of delayed in things that we got done because of, getting data back and things like that from different agencies. So our cycle kind of ran until the end of July. So RNAs were submitted in August. So we spend the bulk of the year collecting data, county, regional, and state data to compile together and put in a needs assessment for our individual regions. And then the state evaluator takes all of our RNAs and kind of pulls that into a statewide assessment. So when we talk about risk and protective factors, so risk factors are things like perception of harm, how many retailers are there in an area, and then protective factors would be like how many resources are present, do they have someone to talk to if they think they had a substance use issue. So this year's RNA had 51 data sources, which is 6 more than last year, yay. We did have a focus group in there. And like I mentioned before, Texas School Survey gives us the bulk of our data on youth use and their perceptions. So the majority of our data will come from Texas School Survey. Say that 3 times fast, goodness. Also Texas HHS, which used to be DSHS. So DSHS was Department of State Health Services, and they went through a transition and now they're Health and Human Services. But when we do trend data over time, the data may be like if it was 5 years ago, it'll be under DSHS, but they're still the same, like, umbrella organization. So like 2019 data might be HHS, but 2017 was DSHS. So that's why sometimes you'll see both in there in the RNA. And then we also, of course, have Census Bureau data for some of our demographics. So here's our lovely region again. And this is also on the back of the agenda that I sent out. So if you're like me and like to doodle during presentations, you probably printed it out to write things down all over it in a pretty pen color or just a regular black pen, which is just as nice. So for demographic data, we're looking at population, but also race and ethnicity, age, languages spoken, and then socioeconomics, because these are all things that can affect the way a region lines up, right? So this year in the RNA, I thought it'd be cool to add kind of a landscape of the grounds. So an overview of the region. So this chart is one of the first ones you'll see. Super proud of it. Shout out to great interns and internships in general. So we have the counties represented, the number of square miles they have, county seat, and then major cities. So you'll see the asterisks for some of the cities. Those are cities that are in more than one county. So for example, like Frisco is in Collin, but a little bit of it is in Denton County as well. And then you have the number of zip codes as well in each county. So the top 3 for square miles is circled, and the top 3 for the number of zip codes within a county is also circled. And I know all of you guessed that Dallas would have the most zip codes because Dallas has the most people out of all of our counties in this region. And it's also like the second most populated county in, second or third? It's a coin toss. Most populated county in Texas. So as you can see, so Erath County has the most square miles, but again, Dallas County has the most zip codes. If you look at Erath County's number of zip codes, it's only 6, and it only has 1 major city. There is an exact threshold number that I used for how I included major cities. If you want to know that, I can get that to you, but I couldn't just tell you right now. I'm thinking it's 10,000, something around there. And for the counties that didn't have at least 10,000, for example, like Somerville, I just put their county seat. Or even like Erath County, I would just put their county seat in there as a major city. So here's a snapshot. So just for kicks, because I'm a data person, I went and pulled some other county zip codes that weren't in our region. So we all know that Harris County, which is that Houston area, is the most populated county in Texas. So Harris County has 241 zip codes. Dallas is second and has 174. El Paso County, which is out in El Paso, has 145. And then followed by Bexar County, which is that San Antonio area. That's in Region 8. They have 119 zip codes. And then Tarrant County has 100 zip codes. And then Travis County, which is that Austin area, has 85 zip codes. So even in the top 5 counties in the state of Texas, 2 of them are in Region 3. So then the logic follows that Region 3 would be the most populated county in Texas, or region in Texas. I'm going to try not to interchange region and county. So just check mark how many times I do it and let me know at the end. So Region 3 is the most populated county. See, did it again. Region 3 is the most populated region in Texas of the 11 regions. Texas is estimated to have, so 2020 is a population estimate. 2017 is what was actually pulled as a final count. So as you can see, in 2017, Region 3 was the most populated then as well. So Texas is estimated to have a little more than 3% of an increase for this 2017-2020 period, even though 6 of its regions are estimated to have a population decrease. Now, Region 3 is also expected to have a population increase of about 4.6%. So as far as Texas having a population estimate of increasing, even though the majority of its regions, 6 out of 11 of them, are going to have a decrease. So looking at this at the surface level, some theories came to mind. So one would be that intrastate migration is really high. So that would be moving from one region to another. So the counties that are seeing or the regions that are seeing a huge decrease may have people moving out, but not out of Texas, just into a different region. That's one theory. A second one would be that more people are moving into Texas than are leaving Texas. And then the third would be that there are higher birth rates in Texas. So those are just some like surface level theories. Didn't go down any rabbit holes to flush out which one was it. But that's just some things to think about. And so as you look through the RNA, see what theories pop up, like what light bulbs go off or what I wonder moments you have. And as we go through this presentation. So for demographics for Region 3's counties specifically, so the counties that are expected to have the highest level of increase are in green, and the ones that are expected to have the highest level of decrease are in red. So Dallas County, Denton County, and Tarrant County are expected to have the highest level of increase, and Navarro County, Palo Pinto, and Parker are expected to have the highest level of decrease. Again, only 6 counties out of the 19, so which means about 13, some stay steady and some decrease, are expected to have, 6 of the 19 counties are expected to have an increase in population. And so that's not the majority, right? But again, overall, Region 3 is expected to have about a 4.6% increase. Now, so again, surface level, the theories that apply for Texas as a whole, as a state, could also apply to Region 3 specifically. So higher education in Region 3. So Region 3 has at least 1 higher education institution in 13 of its 19 counties. This was as of 2016. So now, caution here. The way population data is calculated is based on permanent address. So if you're from Austin and just go to school in the region, wherever your permanent address is where you get counted as population. So you wouldn't get counted in, Denton, Texas, if you went to school in Denton. So that's just to clarify that. Now, if your permanent address is in Denton, then you would get counted in Denton whenever they're doing that population data. But then also think about students who move here to go to school here, and they do their internship here their senior year, and then they just stay in the Dallas area, right? Because they found a job here. They might not go back home or wherever they're from. So that's something that we can think about. Also, when we say higher education, this isn't just like public and private universities. This also includes community colleges, junior colleges, and graduate schools and programs. Yes. So metropolitan data, this is from 2018 from the Census Bureau. So every year they do a top 15 most populated cities in the country. And so Dallas has over 1 million people in the city of Dallas. So this is cities, not counties. But again, Region 3 has several cities that have over 100,000 people in them in their population. Dallas ranked number 9 on that list of 15 most populated cities in the country. Again, not in the state of Texas, in the country. And Fort Worth ranked number 13. And then, so Fort Worth and Dallas also surpassed San Francisco, California, of having a higher population than them in 2018. So we're growing. So when we talk about demographics, we also talk about age. So specifically, we talk about the younger population versus the older population. So percent of population 0 to 17. So that would be everyone 17 until 11 months and 29th day. So that's about 26.5% of the population in Region 3 overall. That's close to the Texas average. 11.3 are 65 years and older. So Dallas, Johnson, Ellis, and Tarrant County has the highest rates of those who are under 18. And Hood County, Somerville, and Fannin counties have the highest rate of those who are 65 and older. So all of the counties, so Hood County is the only county that has a higher population of those over 65 than those under 18. So if you look, it's like kind of in the middle there. So Hood County's population for those under 18 is 21.3 compared to 65 and older, which is 23.9. So fun fact. Oh my God, okay. So this time I threw a pretty graph in there. So demographics for race and ethnicity. So this is Region 3 as a whole compared to Texas. So Region 3 has a higher higher rates in each category except for Hispanic. So if you see that the Texas rate is 40.1, which is very close to the white alone population of 40.5. And Hispanic population in Region 3 is 28.9 compared to white alone, which is 45.9. But in all the other categories, so Black alone, Asian, and races other than one of the 4 listed are higher than Texas's rate. So when we break that down for each individual county, the top 3 in each category are highlighted there. So Hood County has the highest white alone population at 82.8. Dallas County has both the highest Black and Hispanic population, 22.7 and 40.3. Collin County has the highest Asian population at 15%. And Grayson County has the highest rate of those races other than the 4 indicated. So when you look at the breakdown, you'll see that Dallas County and Tarrant County are the only 2 counties in Region 3 that do not have over 50% of their population identifying as white alone. But Tarrant County still has a majority of white alone. Now in Dallas County, the majority is Hispanic population, 40.3, followed by white alone. And if you look at Tarrant County, Tarrant County's rates most closely mirrors Region 3's rates compared to all the other counties. So 45.2 compared to 45.9 and so on and so forth, which I thought was neat. And this was also true for 2019 as well. Okay, sorry, weird sound effects. Okay, so they're part of any good presentation. So demographics also looks at language. So the population of those who only speak English compared to those who are bilingual or multilingual. So Region 3's rate is lower than Texas. So Texas's rate is 35.5%. Region 3's overall rate is 30.7, but Region 3 is higher than the US average, which is 21.5%. And Dallas is the highest, so at 43.3%. That's higher than all 3 other averages. So higher than Region 3, higher than Texas, and higher than the US average. Followed by Tarrant County at 28.7, and then Collin County at 28.1. And Parker County has the lowest rate at 9%. Oh, yeah, that's right, sorry. So limited English proficiency is a measure that is defined by if someone indicated that they speak English less than very well and they spoke another language. So it's a combination of both, not one or the other. So Dallas County has the highest rate of those who of households that have limited English proficiency at 11.4%. This rate is higher than both the regional rate and the Texas average. So the regional rate is 7.1, Texas's rate is 7.9, and like I said, Dallas is 11.4. Somerville County has the lowest rate at 0.5%. And Dallas County also had a higher rate than 9 of the 11 regions in Texas. So, and this is a measure for those 14 and older in a household. So for household composition, it looks at the number of single parent households in a county and in a region. So the highest rate is found in Region 3 is found in Palo Pinto County at 39.7%, followed by Dallas County at 39.2%, and then Navarro County at 38.9%. So this is an important indicator because we know that adults and children who grow up in a single parent household are at increased risk for having adverse health outcomes. So not just behavioral health issues, but also unhealthy behaviors. And we know that children who grow up in a single parent household are more likely to have, are higher risk for, sorry, I wrote it down, severe morbidity and all-cause mortality than their peers who grow up in a two-parent household. So the way they grow up is literally affecting their health outcomes. And this is why this is important to know what that measure looks like in the communities that we serve. So Rockwall County has the lowest rate at 19.4%, but that's still about 1 in 5 households that are single parent households. So Region 3 in Texas overall, about 1 in 3 households are single parent households. And this data is from 2019. So in school homeless student population, this rate is per 1,000. So just really quick sidebar. So when we talk about rate data, the reason this is important is because it paints a different picture than raw data, like just the raw number set. So the more people you have in an area, the more likely you'll have a situation, right? So for example, 10 incidents in Dallas County may not weigh as much on the rate scale as 10 incidents in a smaller county like Somerville or Erath County. So when we take the rate of the population into consideration, it paints a different picture and shows where there actually is a heavier incidence of something, or heavier, I want to say incidence, that's not the right word, but y'all know what I mean. The heavier incidence of something like happening. So you'll see rate data where it's applicable, and that's a good chunk of the RNA will have that in there. So the homeless student population, this is a measure we get from the TEA, the Texas Education Agency. So last year when I did this presentation, I talked about what the homeless student population looked like. Someone in the audience pointed out that this is skewed towards rural counties. So the top 3 are Palo Pinto County at 29.7%, followed by Fannin County, and then Hunt County at 18.1 and 18.0 respectively. And so she talked about how the definition of what the TEA considers homeless is based on a specific law. So I went and looked it up. It's in the notes section, so I'm not going to go through it. But this also includes people who live in motels, hotels, trailer parks, students who are awaiting foster care placement, or if someone lives in substandard housing. So if you look at some rural communities, trailer parks and mobile homes might be the norm, right? And they have a home, they lived there their whole life. And so that being marked as homeless in the TEA system, right? Like this is how it's categorized, might not be the same as what a student they might not consider themselves homeless, right? So even with the data, it's important to look at what these definitions mean, and that will paint a different picture of what the data looks like, right? Compared to, for example, counties that are more urban, like Dallas or Tarrant County or Collin County or Denton County even, they have less rural areas. Denton County has, a few rural areas. I'm like trying to enunciate, so it'll catch all of my words. But again, so if you look at like Palo Pinto County and these other counties that are in red, that paints a different picture. So just knowing the definitions of, so when you're looking at data, just, just a fun fact, or not a fun fact, just tidbit of information, make sure you know how it's defined, because that can help you understand better why some of the data looks the way it does. So for the last 3 school years, Palo Pinto County has had the highest rate. And that rate has gone down from 34.4 to 29.7 but it's still the highest of all the Region 3 counties. So per capita income is a measure that takes all of the money, all the income for those over the age of 15 in a population and divides it by the whole population. So from 0 to the oldest person there. And that's, again, that's a form of rate data, right? Because it doesn't just tell us the total income numbers of how much money came into that county. It also tells us what that looks like divided by each person. So Collin County had the highest rate at over $43,000, followed by Denton County and then Rockwall County. The lowest income was in Navarro County at $23,000, which is $20,000 difference just in one region, right? Just in our 19 counties. Texas's per capita income in 2018 dollars was over $30,000, which is lower than the US, which was $32,000. Region 3 was higher than the US average and the Texas average. Collin, Denton, and Rockwall County had the highest again. And then 8 counties in Region 3 had a higher per capita than the Texas per capita. And 4 had a higher rate than Region 3. So unemployment rates. So the 5 counties that are indicated here are the top 5, and they also are the 5 counties that have a higher rate than Region 3. So Region 3's rate is 3.5, and Somerville County had the highest rate at 4.2%. 4.2% is higher than the Region 3 average and the Texas average, but lower than the US average, which is 4.9. So socioeconomic data is important because, again, we know that financial strains and financial hardship is a risk factor for not just substance use, but also mental health issues. So the breakdown of industry by occupation, so what types of job are in Region 3. In the RNA, there's a breakdown for each county, but I just wanted to include a chart because it's really extensive, so it would look weird on the slide. Majority of the jobs in Region 3 are in the management, business, science, arts sector, followed by sales and office. So some of the jobs in these sectors, so for the management bunch, that's jobs like engineers, social workers, teachers, nurses. Service industry would be like law enforcement, firefighters, childcare workers, wait staff. Sales office would be like cashiers, administrative assistants. Natural resources like construction workers, mechanics, and then production and group would be like bus drivers and day laborers. So the TANF data, which is temporary assistance for needy families, that is also an indicator for socioeconomic status. So the rate, the highest rate for the last 2 years has been in Ellis County. So if you look at Ellis County, it's, and this rate is the number of recipients per 100,000 population. So again, this is a form of rate data because the raw number will not paint as clear a picture as rate data would. So that's over 1,000 recipients per 100,000. That's the highest rate in Region 3 and also higher than the Region 3 average and the Texas average significantly, right? Somerville County has the lowest rate and had the lowest rate in 2019. Collin County had the lowest rate for the last 2 years, 18 and 17. So over the 3-year period, 4 Region 3 counties saw an increase in the rate of the TANF data and the need for assistance. Oops. Nope, not whoops, sorry. That was supposed to happen, not a whoops. So SNAP data, which is another government assistance program. So Region 3's rate was 9.3. Texas's rate is 11.7. So Region 3's rate is lower than Texas. Navarro County had the highest rate at 16.3, which is significantly higher than the Region 3 rate, and it's higher than the Texas rate. So the lowest rate in Region 3 was 3.8% in Collin County. So this is just 2019 data, and I'll show you trend data in a second for SNAP data. But I wanted to show the breakdown for number of recipients compared to number of cases. So number of recipients is just how many individuals. Number of cases will be less than that because one caseload could have several individuals. So think like sibling groups, right? And so average payment per case, so whatever that payment is for, case X would be that payment divided by the, 3 or 4 siblings in that case load, in that case group, sorry. So 10 counties have a higher rate than Region 3 and 4 counties have a higher rate than Texas. And so the 4 counties that are highlighted have a higher rate than Texas's rate. So when we talk about trend data, excuse me, for the last 3 years, So Navarro County has had the highest rate over the last 3 years. So for 2017 through 2019. And most counties, all of the counties except for Kaufman County, either saw a steadying in rates or a decrease over this 3-year period. So school lunch assistance, that's a measure of students who qualify for free or reduced lunch. So I put them together in free and reduced lunch together in a bracket, but it can be broken down for number of free and number of reduced lunches. So the highest rate in Region 3 was in Dallas County at almost 73% of students qualifying. And the lowest rate is in Collin County, over 25%. So that's about 1 in 4 students qualifying. Now I will say that this is the number of students who qualify, not necessarily the number of students who actually use this, this resource. 7 counties have a higher rate than the region, and 3 counties have a higher rate than Texas. So Texas's rate is a little over 60%, and Region 3's rate is about 55%. So uninsured children. So this is the rate of students of children under 18 who do not have medical insurance. This is, again, an important indicator because if you are unable to access care, you are more likely to have poor health outcomes. And that's just another obstacle to, like, another barrier to you getting services. So for the last 3 years, the 3 years in this data set, ERF County has had the highest rate. That rate has gone down from 18% to 14%, but it's still the highest in Region 3. There is no Region 3 measure for the statistic. It's just Texas and then all of its counties. And in some data sets, we won't have a Texas measure or we won't have a Region 3 measure. But for the most part, we will always have county measures, or we'll only have Region 3 or only have Texas. But for the majority of the data sets, most of all 3 types are there. So county, region, and state, and sometimes national. So in 2017, there were 10 counties in Region 3 that had a higher rate than Texas. So Texas's rate was 12 in 2017. And then in 2019, there were 12. So its rate went down to 10%, but 12 counties in Region 3 had a higher rate than the Texas rate. So, all right, so we are going to take a moment here to pause. So that's the end of our demographic section. So in the chat, I want to know what are some things that stood out to you? So what did you see that, like, did the I wonder moments for you? So, all right, so we are going to start with environmental risk, or we're going to continue, sorry, not start, we've already started. We're going to continue with environmental risk factors. So when we're talking about environmental risk factors, so risk factors are defined as something associated with a higher likelihood of developing a substance use or mental health issue. So it doesn't necessarily mean that if you have said risk factor, it's a direct line, right? But we know the more risk factors you have, it kind of is like a snowball effect, right? Similar to, or on the flip side of that would be the protective factors, which add layers, which add buffers to having a possible crisis or issue. So when we're talking about risk factors when it comes to substance use and mental health, that looks like access, perception of harm, social norms, parental approval and peer approval depending on the age. Those of you who work in prevention know that parental approval and parental opinions are most important until a certain point, and then it's all about your friends. And then at some point they say it comes full circle, depending on the friend group. And then the PDMP, which is the Prescription Drug Monitoring Program, which monitors the amount of prescription drugs dispensed in an area. In an area. The one I have is county level. So PDMP would be an example of access as well, but we have it as a separate category. So first up, we have alcohol permits. So the number of retailers, this was as of March 2020. So pre-pandemic, pre-pandemic shutdown. So this is as of March 2020. So Texas's rate is 207.3 per population. So again, when you look at the, earlier I mentioned the importance of rate data. So when you look at the number of permits, Dallas, Collin, and Tarrant County are the high, or Dallas, Tarrant, and Collin County, excuse me, are the highest three when you look at just the raw numbers. But when you factor in things like population and square miles, well, square miles is still the same, but for population, it paints a different picture, right? So population rates, the highest is found in Palo Pinto County, followed by Cook County, and then Somerville County. And that's for population per 100,000. And then for square miles, the highest is in Dallas. So 5 per square, almost 6 per square mile, followed by Tarrant County, which is almost 5 per square mile. And then in Collin County, which is almost 2 per square mile. So 10 Region 3 counties have a higher rate than Region 3, have a higher population rate than Region 3, and 6 Region 3 counties have a higher rate than the Texas average. Now, when we look at tobacco access permits, so, oh, and when we're talking about access permits, it's where the final sale is to a consumer. So it wouldn't be like wholesale retailers. So this would be like your gas stations, your grocery stores, liquor stores, places like that, corner stores. So when we look at tobacco permits, again, it's where the final sale is to a consumer. So Texas's rate is 107.6 per 100,000 compared to Region 3's rate, which is 93.7. One thing off the bat that I noticed was that the rate for tobacco permits, Region 3 and Texas were not that far from each other compared to alcohol permits, right? So Region 3's rate is 93.7. This is the second lowest rate in the whole state of Texas. Palo Pinto, Navarro, and Cook counties had the highest permits per 100,000. And again, Dallas, Tarrant, and Collin County had the highest permits per square mile. 14 Region 3 counties had a higher rate than the region overall, and 11 had a higher rate than Texas. So something else I wanted to point out, Palo Pinto, I always say Palo Pinto and like completely leave out the O, and Cook counties also have they were also among the top 4 alcohol permits. So they are top 3 for alcohol permits and also for tobacco permits. And these are tobacco permits as of April 2020. So when we talk about access, we also talk about drug seizures. So any guesses of where the largest? No, I'm kidding. So marijuana was the largest at almost 94% of drugs seized in Region 3 in 2018 was marijuana. And then the second would be methamphetamines at 2.3%. And this is solid pounds of marijuana. So when we talk about access, it's not always just retail, it's also social access. So in the Texas School Survey, which I'll reference a lot throughout this presentation and also throughout the RNA, students were asked how easy, if you wanted some, how difficult would it be to get blank, right? So alcohol. So all grades is an average of 7th through 12th graders, so all the grades in between. And then, so the average for those who answered very easy, an average for all grades was 27%. When we break that down to 7th graders compared to 12th graders, it's 11.6% compared to 38% of 12th graders. And then when they were asked for alcohol, they were asked, how often do you get alcohol from blank? And they answered parties and friends as for always and most of the time. Those were the highest rates for most of the time and always. And retail, like from a retailer was low on that list, like from a store. Or from home was also low on that list. So they were also asked about social access for tobacco and marijuana. So very easy, again, so all grades is an average of 7th through 12th grade, 17.8%. 5th grade, sorry, goodness, 7th grade was at 5.2 and 12th grade was at 38.8, slightly higher than alcohol. But again, this is 2018 data. So this is before Tobacco 21 went into effect. So presumably some of these 12th graders were 18 and could just go buy it themselves if they really wanted it. It'll be interesting to see, well, I think it'll be interesting to see how Tobacco 21 has affected that access point for very easy for 12th graders. Because, okay, so for those of you who don't know what Tobacco 21 is, let me back up a second. So Tobacco 21 changed the purchasing age from 18 to 21 in the state of Texas with 2 exemptions. So the first is military exemption. So if you present military ID, and the second is if you turned 18 before the law went into effect in September of 2019, you could still purchase tobacco. So that grandfather clause, that second one, will phase out after a few years. And so we'll be able to see, it'll be a true Tobacco 21 law with the one exception of military. So we'll see what change, if any, that had. And then for marijuana, for very easy, the rate for all grades was higher than tobacco at 19.2%. For 7th grade, it was 4.4, and 12th graders was 34.8. So it is lower than tobacco and alcohol, but it's still very high for a substance that's illegal in the state of Texas. That's 1 in 3 students, 1 in 3 high school seniors in Region 3 saying that it was very easy to get marijuana if they wanted some. So the YRBSS answers for Texas 2013 and 2017. So 12th graders were asked how often they were offered, sold, or given drugs on school property. And that's for 12 months up to the survey. So the total stayed about steady at 26.4 compared to 26.7 for the 2013 and the 2017 school years compared. But the rate amongst females went up 23.8. Went up to 26%, and the rate in males, 28.8, went down a little to 27.5%. So another indicator that's a risk factor is perception of harm. So I did it as a comparison for 7th compared to 12th graders, but in the RNA, it does have all the grades and an average of all grades, but I wanted to show what this even 5-year difference looks like. So this is, the TSS is not a longitudinal study. It's a snapshot in time. So those who were 12th graders in 2018 and those who were 12th graders in 7th grade, 7th graders in 2018, sorry. So it's not over time. We didn't follow the 7th graders in the 12th grade intentionally anyway. So you can pick any 2 subsections you want to see, but I'm going to focus on the very dangerous and then not at all dangerous comparisons. So when you look at 7th graders, those they were asked, how dangerous do you think it is for kids your age to use alcohol? So not general, like how dangerous do you think alcohol is, but how dangerous do you think it is for you as a 7th grader and kids your age? So 65.3% of them answered very dangerous, and only 1% said not at all dangerous. So versus 12th graders, who 44%, so less than half of them said it was very dangerous. And 1.3% of them said not at all dangerous. Oh, and then whoopsies. But even like the not very dangerous category increased, right, from 8% compared to 17.4%. Do not know kind of stayed steady. Do not know is concerning because that shows a lack of education. And then somewhat dangerous, that rate was different, 22.1 versus 33.4. But not completely not at all dangerous, but also not very dangerous, right? So perception of harm for tobacco. So the rates for this was higher for both groups than alcohol. So 79.6% saying it's very dangerous as 7th graders compared to not at all at 0.3. And then very dangerous at 51.1% for 12th graders. And then not at all dangerous being 2.7%. So that's higher than for alcohol. Tobacco is higher than for alcohol. So again, as like a surface level, I wonder, e-cigarettes was what I thought of. I don't know what y'all thought of, but drop it in the chat, let me know. And then for marijuana, which this is the biggest difference. So 7th graders, almost 82% of them said it was very dangerous compared to not at all dangerous, 2.5%. That's higher than both tobacco and alcohol. 2.5% of them saying that it's not at all dangerous in 7th grade compared to 12th graders, which is 37%. So that's the lowest rate for all 3 drug groups. All 4 drug groups, excuse me. Prescription drugs are after this, but I wanted to focus on this. So very dangerous at 37% compared to not at all dangerous at almost 25%. That's about 1 in 4 high school seniors in Region 3 who were asked saying that, no, it's not at all dangerous. I'm gonna let y'all stare at it a little longer. So perception of harm for prescription drugs. So again, how dangerous do you think it is for kids your age to use prescription drugs, misuse prescription drugs? So very dangerous at 83% almost, compared to 73.5% very dangerous. Again, this is the highest rate for very dangerous for 12th graders, and then not at all dangerous being 0.8 for 12th graders and higher for 7th graders at 0.9%. They were also asked about, are there drugs? So illicit drugs, so cocaine, et cetera, from the rate from very dangerous all the way to not at all dangerous and then do not know. So it's a lot of squares. So I'm going to leave it up there for a second.
Is this 7th grade or 12th grade?
This is all grades. So this is an average of 7th through 12th graders. So this one wasn't broken down for each age, for each grade group. Sometimes we just get it as all grades.
Thank you.
This is one of those incidents. Oh, good question. Thank you. Okay, so parental approval. So how do parents feel about kids your age using blank? So they were asked about alcohol, marijuana, and tobacco. Again, this is all grades presented. So in the top chunk is Texas and the bottom chunk is Region 3. Chunk is a technical term, so I'm using it. So for strongly disapprove, there was higher rates in Region 3 than the Texas average, and less students in Region 3 reported that they did not know how their parents felt. So they all knew where their parents, whether they disapproved, approved, or neither. The majority of, more of them knew that than the Texas average overall. And again, do not know is something to as a cause for concern, because that shows that there's either not a conversation or a conversation that's not really giving them, they're getting mixed signals, right?
Can I ask a question?
Yes.
What is the difference between do not know and neither?
So neither is that their parents had no opinion one way or the other, and do not know would be I'm not really sure if they think or what they think about it. Does that clarify?
Yes, thank you.
Okay, perfect. No problem. Okay, so this next chart is a lot, so I'm going to break it down. So it's my favorite thing, but just bear with me. So this is a social norms. This is an example of social norms. So this is the CHAPS survey. CHAPS survey is redundant, sorry. The S in CHAPS stands for survey. But this survey is conducted by Cook Children's Healthcare System. They do it every 3 years. They send out a survey to their 6 counties that they serve and ask parents various questions about their children ages 0 to 14. We only pull 3 of those questions. So the 3 questions are, how often do you talk to this child about drugs and alcohol? How often do people in this home smoke cigarettes? And then how often are alcohol beverages consumed in your home? So all the data for those can be found in the RNA. I wanted to focus on something slightly different. So they also, when they ask about how often do you talk to your kids about alcohol, when they sent the data to us, they have, so the first line would be like for Wise County, for example, that's just for the whole 0 to 14 bracket. The second line is for those who have kids, for their child is aged 9 to 14. And so when I looked at this, like, of course, light bulb went off, right? So if you have a child who's 2, for example, you're probably not gonna, you're factored into that first category, right? You're probably not talking to your 2-year-old about a whole lot, especially not drugs and alcohol. If you have a child who's 12, who's in middle school, 13, 14, who's in high school, you're gonna be talking, you might be talking to them more than not, even if it's a few times a year or monthly, weekly, daily. So that's the difference. And so when you look at this breakdown, the first line for the county will be for the 0 to 14, the whole, data set. And then the second line would be for that 9 to 14 bracket. And so you can see that there's a shift, right? In how often, if at all, they talk to their kids. So example of Wise County, just because it's at the top, 49% said seldom, never, or do not know, compared to 18% in the 9 to 14 age bracket saying seldom, never, or do not know. So that number of those who talk to their kids at all, whether that be a few times a year, monthly, weekly, daily, like as they send them off to school, don't do drugs, whatever the conversation looks like. So My interest would just be to know what that conversation looks like, right? Not necessarily are you having the conversation, but what things are you saying to them? So that's a secondary step once you know who's even talking to their kids, right? So this is a chart that I wanted to include. The presentation will be sent out to everyone who attended. So it is a picture in there. So if you're like me and you want to print it out and like stare at it and like draw circles and do all the things, then that will be for you to do. So yeah, this was I wanted to show y'all this, especially because I put so much time into designing this beautiful graph. So another social norms again, so peer approval and consumption. So how many of your close friends use, you know, alcohol, marijuana, tobacco? And this is an average of all grades. So the rates in Region 3 were lower than Texas for most or all of their friends. And, you know, the rates of none were higher in Region 3 than the Texas average. So I mentioned the PDMP, which is the Prescription Drug Monitoring Program. And so that, again, monitors how many prescription drugs are dispensed in an area within a specific time frame. So this is 2019 presented here. I will show trend data in a second, but I wanted to show you what, again, the importance of rate data. So when you take the rate per 100,000 population, so Region 3's overall rate is 136,000, almost 137,000 per 100,000 population. So that's basically about 1.4. I don't know how you give out 0.4 prescription, but that's just the average per person. Fannin County is over 288,000. So that's about almost 3 prescriptions per person. And when we say person, we mean 0 to the oldest person in that county. That's how many prescriptions were dispensed, like individual prescriptions. And then Dallas County had the lowest at 116, a little over 116,000. So that's about 1.2 prescriptions per person. So all of the regions, sorry, the top 3 counties are indicated. So Fannin County, Hood County, and then Grayson County. So if you remember from earlier, these counties also have the highest population for those over 65 and older. So that could be a factor. So this is just crude rate. This is not age-adjusted rate. We'll talk about age-adjusted rate later, but it would be interesting to do an age-adjusted rate for this, for these prescription rates to see how that, because I'm sure it will affect, I just don't know in which direction, right? Dallas County had the lowest rate of Region 3. 16 of the 19 counties had a rate higher than the region, in all except 1. So Dallas was the only county that didn't have a higher rate than Texas. So here's the trend data over time. So again, for the last 3 years, it's been the same 3 counties that had the highest rate. So over this 3-year period, 5 counties saw an increase in the rate of prescription drugs dispensed. So that's the end of the environmental risk factors section. So I want to know, again, what stood out to you. So regional consumption, this section, the majority of it is youth consumption rates. And this is also, again, from the Texas School Survey, except when it's not, and I'll tell you that when it's not. Sorry, technical difficulties. Papers aren't technical, but still. So regional consumption patterns focus on the state's 4 priorities, but also we talk about illicit drugs because it was asked in the Texas School Survey. So alcohol, tobacco, marijuana, prescription drugs, and then illicit drugs. So the first step would be alcohol. Sorry, I'm like holding it down instead of just clicking it, get it together. So the circles are gonna be the highest rates and the lowest rates are circled. This will become important later. Remember I said that. Stay tuned. So the highest rates, so some definitions. So again, all grades are the average of 7th through 12th grade. Current use is the last 30 days from the day of the survey. School year use is within that school year. So the Texas School Survey is administered between December and May of a school year. So that's like from September to right now when you're taking the survey, have you had one drink of alcohol? Lifetime use, have you ever had alcohol? And then high risk use is a specific category for alcohol. So that's binge drinking within the last 30 days. So that's 4 in one setting for women, 5 in one setting for boys, for men in the last 30 days. So current use for 7th graders was 11%. That's about it's a little more than 1 in 10 7th graders. For 12th graders, it was 38.6. Again, this is not a longitudinal survey. This is one snapshot in time, but just a comparison. School year use, 12.7 compared to 45.6. Lifetime use, almost 30% compared to almost 63%. And then the high risk use category, 1.5 compared to 16.5 for high risk use. So, and this is for Region 3 specifically, not Texas data, but that is available in the RNA. So age of initiation would be the first time they ever had a drink, right? So for all grades, the average was 13.2 years old, 0.2. We just want to be very specific about the age. But 13.2 for 7th grade, those who had ever had a drink, they said the average was 10.7. So 10 years old was the first time they ever had a drink. That was the average, 10 and 11. 12th graders, the average was 15 years old. So this, again, is another like alarming statistic because we know that if a child begins drinking before the age of 15, they're 5 times more likely to have a substance use and alcohol dependency as an adult. And so everyone who indicated in the survey that the majority of those, the average of those who indicated in the survey that they had an alcohol, they had ever had a drink of alcohol were under the age of 15, right? So this again is something that's like red flag, right? Goes up. So again, about 1 in 4, up closer to 1 in 3, but more than 1 in 4 had their first drink of alcohol by 7th grade, and the average of that being 10 years old. So for alcohol consumption patterns for adults, we use the BRFSS survey. This is from 2018. So again, some definitions are on your screen for you. So any, again, is comparable to current use, 30 days. Binge drink is 4 for women, 5 for men, 30 days. And then heavy is an average of more than 1 per day for women and more than 2 per day for men in the past 30 days. So the age groups there are indicated for you. So the highest for any and binge were in that 25 to 34 category. And the highest for heavy drinking was in that 18 to 24 category. Now, not all of them are of age to drink, right? Because it's 18 to 24. So that's, again, something to think about. So when asked about tobacco, again, current use 30 days, school year use within the school year, lifetime uses they've ever used. The highest and the lowest are indicated with the circles. For 7th grade, it's 4.6%, so that's lower than alcohol for current use. School year use and for lifetime use are all lower than alcohol. And then for 12th grade, it's almost 25%. So that's 1 in 4 12th graders said that they had had tobacco in the last 30 days. Again, when we think about the popularity of some tobacco products recently, and then also the fact that if they're 12th graders, some of them might be 18 and go purchase it themselves. School year use, almost 30%, and then lifetime use, almost 42%. So this is the tobacco. Again, all grades is an average of all the grades together. Yes, Anthony, you raised your hand.
Does this include e-cigarettes and vapes?
Yes. So I have a graph about that in a second, but yes, it does include e-cigarettes and vapes. So I'll get to that in a second. I promise it's in here. So tobacco consumption for age of initiation was 13.6 for all grades is an average. That's higher for the average of all grades. But when you look at 7th grade, it's a little lower. It's closer to alcohol. So again, 10.6 years old. We like to be very specific about the 0.6 years of age. 12th grade is 14.9. So again, around the same age as alcohol. So Anthony, you asked about what specific type of tobacco products. So the way the question was asked is, in the last, how recently have you used one of the following? So they were asked like electronic vapor products, and it said in parentheses, e-cigarettes, e-cigars, vaping pens, vape pipes, etc. So it didn't say like, did you use tobacco in the last 30 days? Because a lot of them might say no. e-cigarettes aren't tobacco in their mind, right? Or some might say, yes, I know that that's tobacco, or no, I've just been juuling. So it was asked very specifically to get to capture that, just so we can see which type of tobacco they're using the most. So the comparison is cigarettes, smokeless tobacco, and then electronic vapor. So in every category, current use, school year use, and lifetime use, this is an average of all grades, again, 10.8%, 14.6, 23.2. Those rates are higher than all the other, by far, than the other two categories of cigarettes and smokeless tobacco. So marijuana consumption patterns. So again, all grades is an average of 7 through 12. Current is 30 days, school year, within the school year, lifetime is ever used. So the rate in 7th grade is lower than tobacco and alcohol. The rate for 12th graders is close for current use. So 22.2% of high school seniors said that they had used marijuana in the last 30 days. Reminder, marijuana is illegal in the state of Texas. So there's that. 26.8% school year use and almost 36% for lifetime use. Again, age of initiation. So the average age is 14. For 7th grade, it was 11 and a half years old. And for 12th grade, it's a little over 15 years old. So I mentioned earlier that the circles were the top and the bottom in each grade level or in each category. So here's prescription drug misuse consumption patterns. Anybody notice a difference? So again, all grades is 7 through 12. So in current use, school year use, and lifetime use category, the highest rates were in 9th grade, not in 12th grade like in the other 3 drug categories. The lowest rate for current use, which is 30 days, was in 11th grade, and then the school year use and lifetime use was in 7th grade. So before I say my theories, what are some of y'all's theories on why the highest rate is in 9th grade?
I would think some of it has to do with sports injuries.
Sports injuries, okay. I didn't even think about that. That's a good theory.
I would say making a transition into a new environment.
Transition to new, okay. So that anxiety, maybe?
Yeah.
And I would say access in their home environment.
Access, okay. Any other theories? I'll take one more before I throw mine out. Sorry, I can't see the chat. So if you're putting it in the chat, I acknowledge you. I just can't see it, sorry. But I mean, this is my formal acknowledgement of the chat. Okay, so you're all right. So these are some good theories. So sports injuries, transitioning into new environment, and then access is the biggest one. So we talked about access being an environmental risk factor, right? So most adults probably cannot tell you exactly how many pills are in whatever prescription that's in their cabinet. Maybe now they can. Again, this survey is from 2018. There's been a big push for several years about locking up your medicine cabinet, putting away your prescriptions, keeping it out of, don't put it in places that people can just get to it. If someone just comes into your bathroom in your house. So this could be just pure access, right? If you're in 9th grade, you might be 14, 15, 13, whatever, one of those teen years. You may not have an older friend who can buy you cigarettes, may not have access to alcohol. You may be new to a school environment and aren't going to parties yet, or don't have friends who are older. So sheer access, right? Curiosity and access, perfect storm, right? So this could be access. It could be sports injuries this is when they start using prescription drugs and then move on to something else as they get older. So there are many theories, but one of the most evident ones could be just access. So college consumption patterns. So in addition to Texas, oh no, that should be a C, not an S. In addition to Texas School Survey, there's also a Texas College Survey. So Texas School Survey goes out in odd years and is published, goes out in even years and is published on odd years. Flip that, sorry. Goes out in odd years and is published in even years. And Texas College Survey goes out on the other years that Texas School Survey is not being administered. I said that really confusing, sorry. They alternate, that's what I should have said. They alternate. So Texas College Survey, this is from 2017, not 2018. So I have freshman and senior comparisons, but in the RNA there are there's sophomore and junior as well. So just comparisons of alcohol, tobacco, and marijuana use. So freshmen, again, could be 18, could be older, might not be of age to drink compared to seniors who are 21 older, who are of age to drink. So if you look at current use, past year use, lifetime use, those rates increase accordingly. Okay, so like I said, that was a short section. So what stood out to you guys? So the next section we're going to talk about is consequence data. Now this section is pretty bulky in the RNA. So this section of the presentation will also be very data heavy. I did not include everything. So again, the RNA is your friend when it comes to some of the trend data and some of the definitions and things like that. I'll try to skim over some of them, but just for the sake of time, I'm not gonna like get super like deep dive into it. So we're talking about consequences, we're not just talking about legal and mortality. So we're also talking about hospitalization, education rates, crime rates, and then mental health. Clicked it too many times. Okay, so liquor law violation. So that's any violation regarding manufacturing, selling, purchasing, transporting, and then possession, or even using alcohol products. So liquor law violation arrests, again, the importance of rate data here. So the total number of arrests are highest in Dallas, Denton, and Tarrant County, right? Some of our more populated counties. And then when you look at the rate per 100,000, so the highest rates are in Hood County, Cook County, and then Rockwall County. So just a slight disclaimer. So high rates do not necessarily mean there's an increase of alcohol misuse or that drug misuse in those counties. It could just indicate stricter law enforcement. So this data set alone is not like a direct indicator. It'd be a combination of things that would say, okay, yes, there is an increased misuse of alcohol in, you know, X county. So that's just something to think about when you look at, individual data sets by themselves. That's why you need several things to kind of paint a better picture, to give you a better assessment. And you can't just take one thing and run with it, right? So the highest rates, again, were in Hood, Cook, and Rockwall County. Cook and Hood County were the top 3 rates for the last 3 years. So the data set presented in the RNA is 2017 to 2019. And then over this 3-year period, 4 Region 3 counties saw an increase. So Region 3's rate is less than the Texas rate. Texas's rate is 27.9 per 100,000 compared to Region 3's at 20.2. So, oh, I didn't click the button. So drunkenness rates, again, so we have the total arrest rates and then rates per 100,000. So the highest rates were in Dallas, Somerville, and Navarro counties. Dallas was top 3 for, again, the 3 consecutive years presented in the RNA. The Region 3 rate was higher than the Texas rate. So the Texas rate was 177, Region 3 is 193.9, so almost 194 per 100,000. Region 3 saw a decrease in arrest rates over the 3-year period. However, 2 counties in Region 3 saw an increase over this 3-year period. So driving under the influence arrest. So this is specifically just for alcohol. So DUI is not always just alcohol, but this is specifically just for alcohol. So DUI arrest rates in 2019 were highest in Grayson, Somerville, and Rockwall counties. Again, rate data compared to raw data. Texas's rate is higher than the Region 3 rate, 244 compared to 214. 10 Region 3 counties saw an increase over the 3-year period, and Region 3 saw an increase from 17 to 18, but a slight decrease from 18 to 19. So this is one of those instances where there is not a Texas rate. I did not calculate a Texas rate, let me clarify. So the counties are presented there and Region 3's rates. So 2019, the highest rates were in Rockwall, Wise, and Navarro counties. 15 counties in Region 3 saw an increase over the 3-year period from 17 to 19. And 6 counties had a higher rate than Region 3's rate. So again, 275 was Region 3's rate, and 6 counties had a higher rate than that. Drug equipment violation arrest. So 2019, so Cook, Wise, and Rockwall County had the highest rates in 2019. 15 counties again saw that increase over the 3-year period. The Region 3 rate is 82.6, and 8 counties had a higher rate than the Region 3 rate overall. So again, the higher rates don't necessarily, like I said before, it's not necessarily. Oh, Anthony, you raised your hand.
Does drug equipment mean like paraphernalia, like smoking
Yes.
equipment, or manufacturing
Yes.
equipment?
So all of it. So the equipment in general. So any equipment affiliated. I'm gonna write down to double check that, but that's, yeah. So it's equipment in general, not just paraphernalia. Sorry, I'm writing. Okay, so good question, Anthony. Thank you. A lot of good questions out of you. Okay, so juvenile justice data. So this is from 2018. In the RNA, it's 2016 through 2018 that's presented. So this is for total number of referrals. So referrals include for felony, misdemeanor A and B, violations of probation, and conduct in need of supervision. So that could include things like a status violation or referral. So status would be something that is only a crime because they're a minor. So like runaway, truancy. If you're under 18, those are things you could get a referral for versus if you were an adult. So I'm only including referrals for the total referrals in this presentation, but in the RNA, it breaks it down for each category for the regions and for each county. So the total number of referrals are indicated here. So again, Dallas, Tarrant, and Collin County have the highest raw numbers. The highest rates are in Hood County, Grayson County, and then Erath County, respectively. So Hood and Grayson County had the top 2 rates for all 3 years, so 2016 through 2018. 9 counties in Region 3 saw an increase in that 3-year period. So the population rate is based on, this is per 1,000, first of all. Second, this is based only on the juvenile population, like the youth population. So this is not just 0 to the oldest person in that county. This is just for that age group, which is, it'll come to me. It's not coming to me now, but it'll come to me. So 8 Region 3 counties had a higher rate than the Region 3 rate in 2018, and only 1 Region 3 county had a higher rate in Texas, and that county was Hood County. So sales to minors for alcohol. So this is one of the instances where I did not do rate data, I just did raw numbers. So again, Dallas, Tarrant, and Collin County will be, are the top 3. And then these counties, remember, also had the highest rate of alcohol permits, the highest number of alcohol permits, excuse me, and the highest rate of permits per square mile. So again, access, this is one of those things where you can see access and consequences, not like drawing a straight line, but drawing one of those, like, I don't know if y'all can see me doing the zigzag, but one of those like zigzag lines, like you connect enough dots and this is where you end up. So this is sales to minors. So this is also selling, serving, dispensing, or delivering alcohol to a minor. This is 2017 through 2019 data, and they were the top 3 for each year. And this again is raw data, not rate data. So when we look at tobacco violations, this one we did do per population just for 2019. So Texas's rate was 2, Region 3's rate was 2.1 per 100,000. Hunt, Hood, and Dallas counties have the highest rates per population. 4 had higher rates than Region 3. So that's on there. So the Texas prison population. So this is the on-hand prison population. So those who are currently in prison for drug or alcohol-related charges. So this could be delivery, possession, driving while intoxicated, or other drug charges. So again, I'm only including the total number here, but in the RNA, you can find the breakdown for each of those categories. I will say for the other drug charges, only 5 counties had any data to report there. The other counties had 0, or the data was suppressed. And that's indicated on there as well. So the highest raw numbers, Dallas, Johnson, and Tarrant County, and the highest rates were Palo Pinto, Hood, and Navarro County. Hood and Palo Pinto County had the highest rate for, were the top 2 for the 3 years that the data shows, so 2017 and 2019. Excuse me. So there were 15 counties that had a higher rate than Region 3. So Region 3's rate was 87.1. So again, the highest was in Palo Pinto County at 595 per 100,000. Compare that to like the Region 3's rate overall at 87. Texas's rate is 98.8. And then 12 of these counties saw an increase in the population over the 3-year period. Whoopsie. No, okay, sorry. So DUI crash data. So this is data that we get from TxDOT. So Texas Department of Transportation. Sorry, I'm trying not to do the acronym thing. So again, raw data and comparison for rate per 100,000. So the highest rates were in Cook, Erath, and Palo Pinto County. Cook and Erath were amongst the top 2 rates for the 3-year period shown, so 2017 to 2019. 9 regions saw an increase from 17 to 19. In 2019, there were 13 counties that had a higher rate than Region 3. And the Region 3 rate is lower than Texas, so 74 compared to 84. So DUI injuries, so not all crashes have injuries. So sometimes the number is less, sometimes it's more, depending on how many people are in the car, like if in a crash. So 2019, the highest rates were in Navarro, Cook, and Somerville County. 9 Region 3 counties had an increase over that 3-year period. Texas's rate was 57. Region 3's county was almost 50 per 100,000. And 12 counties had a higher rate than Region 3 in 2019. So again, the highest being in Navarro County at 90, compared to Region 3's average of being almost 50. So DUI fatalities, Texas's rate was 3 per 100,000. Region 3's rate was 2.5 per 100,000. Highest rates were in Hunt County, Fannin County, and Hood County, respectively. 8 counties saw an increase in DUI-related fatalities, and 13 counties had a higher rate than Region 3's rate of 2.5. The highest being in Hunt County at 12.8%, 12.8 per 100,000. Sorry, not percent. Cancel that order. And this is 2019 data. In the RNA is 2017 and 19. So DUI driver fatality, so specifically the drivers. So Texas rate was 2, Region 3's rate was 1.6 per 100,000. Hunt, Fannin, and Kaufman counties had the highest rates per 100,000. 7 counties saw an increase over the 3-year period. And again, 13 counties had a higher rate than Region 3's rate of 1.6. So earlier I mentioned age-adjusted rate and crude rate and the difference there. So for suicide rates for 1999 through 2018, we get this from CDC Wonder, and this is a good display of crude rate versus age-adjusted rate and how that could slightly adjust the data numbers. So crude rate is just the raw number, right? So the number of deaths divided by the population times whatever your like 100,000, 10,000. In this instance is 100,000. So for age-adjusted rate, it adjusts for where age could factor into the findings, right? So an example of this would be like heart disease rates being higher in a area that has people who are over 50, right? So with an age-adjusted rate, you can get a clearer picture of whether those rates are truly higher than the norm, quote unquote, or if they're higher just because the people there are older. So that's why age-adjusted rate is useful. So here you see that the top 3 rates for crude rate, crude rate and for age-adjusted rate are the same. So Somerville, Fannin, and Palo Pinto County have the highest rates of suicide rates for the 1999-2018 period. There is no Region 3 rate measure for this rate. It's just Texas and all of its counties. So 14 counties have a higher rate than Texas for both crude rate and for age-adjusted rate. So 14 out of the 19 counties have a higher rate than Texas. And Somerville County at 21.8% has almost double the Texas rate. So the alcohol-related death rates, again, from 1999 to 2018, also from CDC Wonder. So it also shows crude rate and age-adjusted rate. So Palo Pinto, Hood, and Navarro counties had the highest crude rate. And then for the highest age-adjusted rate, it was Palo Pinto, Navarro, and then Hood County. So still the same three, but just the order was a little different just for the last two. So Palo Pinto was still the highest in both categories. 5 counties have a higher rate, have a higher rate, excuse me, than Texas for both categories. So if you see the little asterisk, that just means that the number was the numerator was below 20, so the data was not, it's not reliable enough to divide out. So for drug-related death rates, again, 99 to 2018. So Cook, Grayson, and Hood counties had the highest rate for crude rate, and then Cook, Hood, and Grayson County, again, the order flipped between the last two, had the highest rate for age-adjusted. Texas's rate was 9.5 and 9.6. Again, the asterisk meaning it's the numerator is less than 20. 9 counties had a higher rate than Texas for both categories. So when we talk about hospitalization, we're talking treatment specifically for substance use. So Region 3 substance use treatment for 2019 for HHSC funded facilities specifically. So the highest rate was, the highest percentage was marijuana at a little over 25%, followed by alcohol at almost 25%. So 25.46 and then 24.26. Then followed by methamphetamine, which includes amphetamines in this specific data set, and then heroin. So those are the top 4. And this is for substance use treatment for adults. So when we look at youth, I put the regional rates as well in here. So all except 3 regions reported more than 90% of the youth who, so youth is defined as 12 to 18, youth who enter treatment listing marijuana as one of their drugs of dependency. So only 3 regions had less than 90, and even they were in the higher 80th percentile. And Texas overall was almost 93%, and Region 3 was about 93%. I just put that map in there again so y'all could see where the regions match the areas. So when we break it down for Region 3 versus Texas specifically, so this is that was 2018 data specifically. So we have a breakdown of 16 through 18. So these are the raw numbers. So this is the way the categories are broken down. So they were asked to list the top 3. They were given an option of listing up to 3. So if they listed the same category more than once, so if they put marijuana, weed, and codeine, then marijuana and weed would be counted as 1, and then codeine would be counted as 2. So they weren't counting it more. They didn't count them as duplicates. They didn't count duplicates, if that makes sense. So the top has the definitions of what fell into each category. And so you'll still see that of the almost 4,000 that went into treatment in 2018 in Texas, over 3,600 listed marijuana as a drug of dependence. And then similarly in Region 3, out of 820 who went to treatment in 2018, 764 of them listed marijuana as one of their drugs of dependence. And that's in both Texas and in Region 3. That's way more, not even just a little bit more, that's way more than the nearest category, which is alcohol, 285. So when you look at adults, the margins are a little narrower. So it's marijuana right after is alcohol. With youth, it was marijuana by far, right? So EMS calls for overdose. So this measure is for, I didn't include the Texas measure, but it's just 100%. So it's raw numbers and then the percent of the Texas total. So this is not rate data. So of the calls that were made in Texas, almost 25% of them came out of Region 3. More than 10% of those calls were made in Tarrant County, so 10.08%, which is the largest percent of all counties in Texas. This was the highest. So that's one out of 10 calls in Texas for an overdose to EMS was in Tarrant County. Tarrant County has a greater percentage than 7 of the 11 regions in Texas, like overall, like the region overall, not just bigger counties. So what do you think could be, so I have some theories, but I want to hear y'all's theories as well. So what do you think could be some reasons? What do you think could be, why do you think that? What are some theories about why that 10% in Tarrant County? What do y'all think? You can drop it in the chat. I'll look at the chat. Any ideas? I just want to hear my theory. Okay, I'll tell you. Oh, no, ignore that. Sorry. Okay, so, oh, somebody just put something in the chat. The amount of rural areas, maybe a large homeless population. Okay, okay. All right. So that, I didn't think of those, I'm gonna write those down. So some of the theories I came up with were, it could be that there was an increase in education about recognizing the signs of an overdose, right? So again, for a few years now, we've been educating people on like Narcan and Naloxone, and like if you see like someone overdosing, call for help. And so that could be one of the factors. Another one could be that people are, again, recognizing those signs and acting quickly. And then third could be that the EMS coding has become more specific for this category, right? That there's more accurate coding or a specific category now for that. So those are some, again, surface level theories, did not like do any rabbit hole digging down any of them. But those are some things I thought of. Stigma. So like reducing stigma about overdoses. Now this is overdose in general, not just opioid overdose. I want to clarify that. I think I might have said opioid overdose, but this is in general overdoses. Okay. So we just took a break, so we don't need another break. So HIV diagnoses. So this is again a consequence, an indicator of consequences from drug use or illicit drug use. So the number of new cases in the state of Texas, the rate was 15.7 per 100,000. The rate in Region 3 was higher than that at 17.2. The highest rates were found in Dallas, Tarrant, and Ellis counties respectively. Dallas and Tarrant had the top 2 rates for the last 3 years. So this is 2016 to 2018 data. Dallas had a higher rate than Region 3 and Texas. So Dallas's rate is 30.7. The second closest one is 13.2 in Tarrant County. So Dallas has a higher rate at 30.7 per 100,000 than Region 3 and Texas, and has had that higher rate for the last 3 years in the that I included in the RNA. The highest rate for new HIV diagnoses in 2018 was found in that 25 to 29 age group. It was nearly 3 times the state rate. And the rate in males was nearly 5 times that of females. And that's by sex at birth. And that's 2018 as well. So the rate of people living with HIV, so that's cases and then cumulative cases. So that's 2 different numbers. So the rate was 327, almost 328 per 100,000 population in Texas overall. In Region 3, again, it was higher at 377. The highest rates were Dallas, Tarrant, and Kaufman County. Dallas at 708 per 100,000. Again, significantly larger than Region 3 and Texas, and even the second closest one, which would be Tarrant County at 280. The highest rate for people living with HIV in 2018 was found in that 50 to 54 age group. That was almost twice the Texas average. And again, Dallas has had a higher rate than Region 3 and Texas. So people living with AIDS. So this rate is 6.6 for Texas and 7.1 for Region 3. Again, Region 3 being higher. The highest rates were again in Dallas County, Navarro, and then Johnson County. So Dallas and Navarro had higher rates than Region 3 and Texas. So Dallas is at 12.4 compared to Region 3, 7.1 and 6.6 in Texas. The highest rate for people living with AIDS in 2018 statewide is in that 30 to 34 age group, which is almost, it was more than twice the Texas rate. So for education, we look at two things. We look at disciplinary data, and then we also look at dropout data. So for disciplinary data, it's for, and the definitions are in the RNA. So in-school suspensions, out-of-school suspensions, DAEP, and then JJAEP. So for ISS, the highest rates were in Hood, Parker, and Rockwall County. For OSS, it's Palo Pinto, Rockwall, and Hood County. Dallas County had the highest rate for expulsion rate. For the places that are 0, it was truly 0. For the places that are asterisk, it was the data was suppressed, and that's part of that is due to FERPA. Yeah. Oh, we caught it. Good. So I know we've been asked before. So can we tell you if it's broken down for disciplinary data for drugs? So yeah, we can tell you, but the more specific you get, in some categories you end up with suppressed data, because if it was like 4 kids in that county, that there's a specific number, but if it's like, let's say 4 kids who got suspended for tobacco use, then that number would just be suppressed and we wouldn't know it was 4. It would just show up as an asterisk or like a -999 or something. It's a specific code in the, so that's, yeah. And this is for 2018-2019 school year. And this rate is per 1,000 students. When we look at dropout rates, this is percentage wise. So again, this is one of those data sets that's the counties and then Texas as a whole. So I don't have a Region 3 rate for this. So in 2018-2019, the highest dropout rates were in Erath, Dallas, and Somerville County. Texas's rate was 1.4. Erath being the highest was at 3%. Dallas was at 2.7, and then Somerville was at 2.2. They were the top 3 rates for the 3 school years indicated here. 10 Region 3 counties saw an increase in dropout rates over this 3-year period. Texas saw a decrease from 5.9% in the 2016-2017 school year to 1.4%. And dropout rates do not include the rates of students who moved to another school or students who passed away. So for crime data, there's 2 major categories. There's property crime, and then there's violent crime. So for property crime, for property crime, there's burglary, larceny, and then motor vehicle theft, auto theft, because it fits in the box for Excel. And if you're an Excel person, you know you want all the rows to fit the same. But auto theft and motor vehicle theft are the same. It's just shorter than motor vehicle. So burglary, breaking and entering, stolen property, et cetera, all the definitions again are found in the RNA, so you'll see it in there clearly. I'm not going to go through them just for the sake of time. The top rates for burglary were in Palo Pinto, Dallas, and Navarro counties. These rates again are per 100,000 population. And then these are 2019 data as well. So the top Dallas and Navarro counties had the top 2 rates for all 3 years indicated for burglary for 2017 to 2019. The highest larceny rates were in Dallas, Tarrant, and Navarro counties. They were the top 3 for all 3 years in the RNA. And then auto theft, Dallas, Tarrant, and Kaufman counties. Dallas and Tarrant were top 3 for all 3 years. Dallas County had a higher rate than Region 3 in 2019 for auto theft. So for violent crime, there's 4 categories that fall under violent crime. So murder, rape, robbery, and then aggravated assault. Again, abbreviation to ag assault because it fits in the box in Excel to copy and paste. So just, so the highest rates for murder were found in Dallas, Cook, and Hunt counties. Highest rates for rape were in Navarro, Erath, and Johnson counties. Robbery rates were highest in Dallas, Tarrant, and Navarro. And the highest rates for aggravated assault were in Hunt, Navarro, and Dallas. So I've been asked before, so the difference between robbery and like burglary, larceny, and theft is the presence of a weapon. That's the major difference. One of the major differences. So again, when we talk about consequence data, we talk about mental health in addition to other consequences. So the 2019 NASDA survey, which is done by SAMHSA. So here's the overlap. So 9.7 million Americans had a substance use disorder, but no mental illness. And then 9.5, there's an overlap. 42 million have mental illness, but no substance use disorder, out of the 51 million who had a mental illness. So, sorry, I'm trying to break down my data. So I'm gonna read you some stats here. So that's 18.4% of those who had a mental illness also, they had a co-occurring disorder. So co-occurring, trying to get the word out, co-occurring disorder is when you have a substance use disorder and a diagnosed mental illness. So of the 9.5 million who had a co-occurring disorder, only 7.8% received both SUD and mental health treatment for both their substance use disorder and for their mental illness. And that's for any mental illness, not just severe or other categories. So 7.8%. That's like 1 in 12, roughly, very roughly. 48.6 received treatment for one or the other. So either their substance use disorder or their mental illness, but over half of them, so over 51% of them received no treatment at all for either or. So for either the substance use issue or their mental health, mental illness. So so in the NASDA, it's also broken down for any mental illness, serious mental illness, and no mental illness, compared to past year use for illicit drugs, marijuana, and opioids, and then past month for alcohol and cigarettes. So in all the categories, you'll see that those who said they had a serious mental illness ranked high. They had the highest percentages in each of these categories. And those who had any mental illness also ranked high. So those who had no mental illness had not as high rates as the other two categories. So again, in the BRFSS, we look at, oh, I skipped a slide. Excuse me, sorry. We look at the rates of depression, and this is a state rate compared to the national, and then also the breakdown of male and female for Texas. So the black boxes are Texas rate. For all and the bottom is for the years. So all of the years, the female rates of depression were higher, with the exception of 2016, than all the categories. So in 2016, the rate was higher in the US than female, but that's the only instance when the female rate of depression was not higher. So prevalence by race. So 2015, 17, and 18, the category for multiracial non-Hispanic had the highest rates of depression. And then in 2016, the highest rate was white non-Hispanic. Prevalence by age group. So the highest age group was that 55 to 64 age group category. So there's a lot of theories, right? Empty nesting, et cetera, et cetera. So that was the highest category for age group for prevalence of depression. But even if you look at the other age groups, you'll see that over time, some of these categories, so for example, the 18 to 24-year-old category, the rates of depression increased. If you look at even the 55 to 64 category, it increased a lot in 2017 and then went back kind of down in 2018, but it's still higher than that 2016 rate, 45 to 54. So some of these categories increased over time. All of them, sorry, increased over time. Okay, so this is the consequence data section. So trying to see how many slides I have left. So I'm going to go through the environmental protective factors, and then we'll talk about what stood out to you in both of those sections. So just be pondering. So protective factors. So I mentioned earlier that risk factors increase likelihood of developing an issue down the line. protective factors are buffers, right? They're associated with a decrease in likelihood of you having a substance use issue or mental health issue. So that's things like social services, community-based programs, things like that. So the first piece of information, in 2019, there were 16 substance abuse prevention community coalitions, either state or federally funded in Region 3, the bulk of those being found in Dallas and Tarrant County. So that's good, right? There's a lot of community efforts for substance misuse prevention, funded ones. So I mentioned earlier that Cook Children's does a survey, the CHAPS survey. So they they have 12 different community collaborations in 6 different counties. And so these are the 6 counties that they serve. And they have several initiatives, and they're all focused on some aspect of children's health. So like in Denton County, they focus on mental health. In Tarrant County, there's a homeless initiative. There's oral health in Tarrant County as well. So there's different focus areas for these different coalitions. But on the list of that can be found in the RNA or on their website. As far as tobacco cessation, there were 8 counties that had a tobacco cessation program that were county specific. Now they're the overall ones, like the National Quit Hotline, things like that. But as far as having specific programs for your county, 8 counties out of the 19 had a specific tobacco cessation program. But there are no youth cessation programs for tobacco in Region 3. And the bulk of the tobacco cessation programs were found in Tarrant County. So behavioral health providers, again, another protective factor. So the Region 3 had 119 substance use treatment facilities and 70 mental health providers in our region total. The highest being in Dallas and Tarrant County, 38, 35 for substance abuse treatment facilities, and then mental health, 18 and 17. Local mental health authorities. So every county in Region 3 has at least has a mental health authority. So there are 7 total different mental health authorities in Region 3 servicing one of the 19 counties. Some of them only service one county, like in Collin County, LifePath only services Collin County. And then you have other mental health authorities like NITBA that service several counties. So family domain. So in the Texas school survey, students were asked, if you had a drug or alcohol problem and needed help, who would you go to? So first, I have to tell you that only 17.7% of students said that they would seek help if they had a substance use issue. So of the 17%, this is who reported who they would go to. So the majority of them said that they wouldn't seek help. That's something to think about. So the majority of them, so almost 72% said that they would talk to their parents if they had a substance use issue. So again, we talk a lot about in prevention about how parents are the first line of defense. And so for the students who said that they would seek help, most of them said their parents would be who they talk to first, followed closely by friends. So something to think about, right? So students were asked which sources, if any, they were receiving drug or alcohol information from in school. And this is where so the majority of them got it from an assembly or a school health class. So assembly programs, so for example, like Red Urban Week, right? We do a lot of Red Urban Week stuff in prevention. So, and then school health classes. So Region 3 compared to Texas was high in all of the categories. And so another school domain are recovery high schools. So there are 4 total in Region 3. So a recovery high school is when students, after they get out of treatment, when they return to school, sometimes they don't want to return to their home campus or they need a more, so for these programs, they have a smaller ratio of counselor to student. They have a smaller ratio for counselor to student. So Serenity High School, which is in Collin County, and then Winfrey Academy is in Tarrant County as well as Dallas County. They have 3 different campuses. And then there's also recovery in higher ed. So there are 5 universities that have a program for students in recovery. So that could be support groups and programming. That could be an entire department or even buildings on campus. And so the 5 are listed here, and they are accredited. Both the recovery high schools and higher ed have accreditation specifically for recovery. So trends of declining substance use. So 2016 compared to 2018, you'll see that in all the drug categories, so alcohol, tobacco, marijuana, prescription drugs, and illicit drugs, there was a decrease, a slight decrease for all of the current use data, with the exception of tobacco. And the rates were also lower in Region 3 than they were in Texas. So with the exception of tobacco, there was a decrease in each category. And I know a lot of you are thinking e-cigarettes, right? So OSAR, 2019, the most screenings were conducted in Tarrant, Dallas, and Collin counties. So unduplicated and total are different because someone might call more than once or might use those services more than once. And so how many times that individual came through the program is counted as unduplicated, and then total would be, that would be counted in the totals. So if someone came, used OSAR 5 times, they would be in the total, but they would only be counted once and unduplicated. So Tarrant County had almost double the screenings as the second highest county. So Tarrant County had over 3,700 compared to Dallas's 1,500. Over 50% of the screenings in Region 3 were conducted in Tarrant County. So yeah, all of that. I know what you're all thinking. That was a lot of information, a lot of great information. We're so glad you came. I want to take a second to know what things stood out to you before we jump in for discussion. Okay, so here's a citation for the RNA. I always include citations. So thank you all for coming to, there's a little thing that it does. Okay, I just get really excited about that part. So thank you all for coming for today. So the CEU link will be dropped in the chat momentarily. So please make sure you fill that out in order to get your CEUs. They'll be emailed out to you next week. So yeah, shout out to the dream team, my PRC people. Thank you guys. Couldn't have done it without you. So thank you all for being here today. If you have any questions that I didn't answer, any comments, all the things, please feel free to shoot me an email. My email is listed here. Email is the fastest way to get me, and the fastest way to get me. Let me know any questions that you have. If you need any links to anything, I'll be sending out an email again, a follow-up email next week.